To all you nursing students struggling with nursing pharmacology, stop trying to memorize the drug. I'm going to teach you a better way to study pharmacology. So first off, save your money. Don't buy those expensive drug cards for sale on Etsy and whatever. And don't waste time creating your own drug cards unless you just absolutely have to, because unfortunately your school requires you as an assignment. Instead, you want to take a two-pronged approach to studying every medication in nursing school. First is you don't have to study every medication in nursing school, not if you use the prototype method. Now, some people criticize this method, but that's because they don't know what they're talking about. So the first step is to forget about studying individual medications and focus on drug classes. This will immediately reduce your studying by probably half. So what you're going to do is you're going to pick one medication as the prototype for that drug class. Because guess what? They put them in a drug class for a reason. It's because they're all pretty much the same. And I'm not saying that the nuances between the drugs are not important, but they're really not that important in nursing school. Then you study the medication not to memorize, but to understand. And the way I recommend doing that is with the Silver Bullet study system. It works super, super well with the prototype method. It's what I do with all of my tutoring students. And you get a free overview, a 10-minute video, and a download about how to do the Silver Bullet study system in my bio link. You just have to put in your email and I will send it to you for free. So once you go through the 4 steps of the Silver Bullet study system for the prototype of a drug class, then you'll feel confident that you know everything you need to know about that drug class and about every medication in that drug class. Which means when you get a test question about it, doesn't matter what medication it asks, as long as you know what drug class it is in, you answer the question as if it was the prototype, even if it's not the prototype. Because again, they're all in the same drug class for a reason. Now the haters always say, oh, but how am I going to know what drug class it is if I didn't study that medication? You're going to be able to figure it out from context clues, okay? If the question scenario includes a patient with a respiratory infection, chances are the medication is going to have something to do with respiration or infection. So maybe a bronchodilator or something to make them breathe easier, or something to beat back the infection like an antibiotic. Another really easy context clue is if you are taking a renal exam in your pharmacology class, chances are they're asking you about renal medications. And then there's always the go-to that some drug classes have the same endings at the end of all of their medication names, and that could be a good clue too. In any case, as a professional nursing tutor, surprisingly, I don't care about getting you straight A's in nursing school. I just want you to learn to think like a nurse confidently and calmly, and to know the most important information that you need to know. Because if you can do those 2 things, you will be successful as a nurse, and you will be the kind of nurse that I want taking care of me and my family when you graduate. Go to my bio link to download that Silver Bullet study system overview so you can understand how you should be studying those drug classes besides memorization.